Today I will be addressing barriers to improve communication and just help connect with others. I will be looking at 3 studies that include barriers, including not gaining information that is necessary, looking at pre-existing connotations, as well as stress. So those barriers would come into perspective in the sense that would you communicate differently if you had to listen to what you said after it had been recorded? Healthcare professionals were listening to their conversations after having them with patients, and one physician was especially surprised to find out that 89% of the conversation was speaking rather than listening, and then within that conversation there had been 15 interruptions of the patient. So therefore, that smartwatch had recorded those interactions. And what was even more problematic was that poor communication related to symptom management that was showing that underrepresented racial and ethnic groups are significantly more at risk to suffer with untreated pain, die in intensive care, and experience poor communication about their healthcare issues and needs. So gaining minimal information and neglecting to ask relevant questions are communication barriers. Also, personal bias. What responses to what we have heard are not assessed apart from emotion? So one study took 120 words, and the positive words would be like baby. The negative words would be like war. They had already been evaluated, but then they divided the study between men and women and had them rate these words as extremely good, quite good, good, slightly good, etc. And they had to be 18 years or older and had to have access to the computer, and it was from a total of 300 individuals. So did males and females hear the message the same? Overall, they did, but in areas where the words were already negative, those connotations had differed by gender on their emotional evaluation. They were rated 0.71 negative by women and 0.38 negative by men. So it appears that females show greater neural activation to negative emotional stimuli. Connotations emotionally may affect how we hear others in conversation, which can provide a barrier to connection. For example, you just feel more negative based on the words versus somebody else. Another study took 74 undergraduate students and had them distracted while they were driving, whether they were driving slow or fast, and they had audio prompts asking them questions while they were driving, and these were pre-recorded messages, and they had to actually drive in a simulator, not an actual vehicle. This study was the first to track temporal changes in the interference at high resolution during the first 100 milliseconds of verbal production and comprehension. So as you think about the steps of listening, you're listening and identifying, decoding meaning, and then you're waiting for your turn and you're encoding it to your message, and then you're going to articulate those responses. So on the left side, the difficulty while driving fast, it was much higher to listen and respond versus just those slower speeds. Results from the overall analysis showed during slow speeds the performance did not significantly change, but during fast speeds it worsened. So that fast speed compared to that slow speed, that was the difficulty differential. So overall, 3 barriers in communication include not gaining the right information, looking at pre-existing connotations versus the emotional impact for someone else, and then the stress, such as driving. If you want to look more into these studies, these are the 3 resources I used to compile the research on these